Dr. Ramya.
I'm Dr. Lata Venkatram.
So we are a group of 16 doctors who are WMN doctors. Ma'am, this group...
Too many women
Yes.
in the kitchen, isn't it? Yeah.
Yes.
Yeah.
So this group practice is very unique and new concept. And you established first South India's obstetricians group practice, that too way in 2007. Why did you think about that?
Yes. Very important question, Ramya. See, when we worked in the West, people used to work as groups and they would have a very low caesarian section rates. They would go with nature, and also 24/7, the women and their babies were kept safe. So if I am a single practitioner, it would be so very difficult for us to do this.
Yes.
You know, being available for 24/7 throughout the year, and also no holidays, and also it's very, very difficult, isn't it? And also it's not a 9 to 5 job. Obstetrician's job is not a 9 to 5 job.
Yes.
It's very important that we give time for every labor. We make sure that it's safe for both the mother and the baby. And also we bring down the section rates also. If we did not go with nature, if we programmed labors, I think the section rates will go up, isn't it?
Yes.
And
So
also
you
the
say-
safety is compromised. So I thought we should practice as a group.
Okay.
Okay. So to give quality care to women, very important that we are dedicated to give the best care to women.
So you say deliveries need not be timed?
Should not be really. We should be available.
Yes.
Babies want to come when they want to come. We should be ready to catch them.
Yes, ma'am. So, it is your vision definitely, to bring a different perspective in the maternity care. So, how did it change, like our cesarean rates or?
Our caesarean rates for the first time mothers, you know that, Ramya, it is just 10 to 15%. 85 to 90% of them have normal deliveries with us.
Okay.
It's so very important for the baby to travel through the birth canal. Lot of programming happens. Okay. The gut programming especially, because the gut microbiomes, they get programmed when the baby is going through this magic tunnel, I call it. Okay. And 80% of the immunity is gut immunity.
Okay.
Which prevents what we call as non-communicable diseases, that is diabetes, blood pressure, cancers, immunological problems, etc., etc. So, isn't it important that we give this individual the best for his or her life? And also it's just doesn't stop at physical level. Mentally also, baby gets programmed for stress coping mechanisms. So, the whole journey through the birth canal has a very big impact on this person's health for his or her life,
Okay.
mental and physical. So that's why. And also very safe for the mother. People think cesarean section is safe. It
Yes,
is such a
that
myth.
concept I think we should definitely, we should
Change.
make the people aware of that, ma'am, because there will be like some muhurtam section.
Yes.
And
Yeah.
there are a lot of things on this day, numerology, so many things, but the baby should decide when the baby wants to come.
Yes, it is like the fruit getting ripened and separating itself from the stalk and falling. Here, the baby decides when to come out, when it is mature enough. Of course, if there are indications where there is, where we are worried about the health of the baby or the woman, yes, we have to intervene. Otherwise, we should not be intervening unnecessarily.
And why do you think people need to choose us?
Well, they should understand the concept that it is so very important for them to have a normal pregnancy, normal delivery, and also somebody who would assist them or encourage them to breastfeed for 18 months, which
that is very
goes
important.
a long way in this individual's health. for life, I tell you.
So now
It is just not an event of labor. It is a continuum, After this individual is born, whatever has happened, it continues. So I think it's very important.
because
to give
now the
best.
thought process changed a lot. Everyone is thinking cesarean is safe. Going for a normal delivery or vaginal delivery is definitely a complicated thing. So that thing should be changed. That we should create awareness among the people. That should go and reach them. That's what.
Absolutely. And also, caesarean section is riskier. People don't understand that. 4 times more chances of death and problems. Okay, anesthesia can cause problem. Surgery can cause problem, though it is made safe. I'm not saying wherever there is an indication, yes, we have to do it, and we are a high risk center, so we do very complicated cesareans, etc. But I think it's important that people realize, and also obstetricians, we should be dedicated to give the best for our women to have the best quality progeny. As obstetricians, we have a unique opportunity, Ramya, to give the best for 2 lives.
Yes, mother
and baby. Mother and the baby. And if this is a female baby,
Going to be an experience of 3.
that's right, going to be the experience of 3, because when she becomes a mother, she will give better progeny. Okay, so that's why our slogan is Matruswasthyam Lokaswasthyam.
Yes, ma'am.
So if the mother is well, the whole world is well. So I think it's very important that we realize that, and also people realize.
Should realize.
Yeah.
Ma'am, what are the reasons do you think why the cesarean rate is just increasing?
Yeah. People want to deliver on a particular day at a particular time.
Okay.
This horoscope or horror-scope is becoming more common a request. Okay. Yeah. The other thing is, women think section is safer for their baby and for themselves, which is really a myth. Okay. Actually, I have told you that it's associated with more complications.
Yes,
and
definitely.
yeah, whatever the baby misses, that is not by traveling through the birth canal, you can never supplement it, substitute it in its life. So people don't know what they are not giving their baby. After the baby comes out, they fall head over heels to give it the best. But when the best is already missed, isn't it? Yeah. So anyway, I think awareness in people is lacking. The third thing is preparedness from the medical fraternity.
Okay. So doctors are also responsible.
Yes. Yeah. To wait, and also for waiting, you need to have many things available. A proper person to monitor the baby and the mother, and also if cesarean is needed, to do it at the shortest interval. Everything should be prepared. You should have anesthetic team, neonatal or pediatric team available. All these could be a problem in various setups. Various setups have various issues. So people might not be. And also single practitioners working 24/7, 365 days. Who can cope with it?
It is impossible, definitely.
It is, isn't it? See, NICU, ICU and labor wards, the consultants would be changing every 8 to 12 hours in most of the countries. Yes, where they have lowest mortality and morbidity and also lowest section rates. So it's so very important to bring this concept of group practice. By doing group practice, it will bring it down. The other thing is medical legal issue. People think that if section is done, something ultimate is done and nothing else could have been done. So the litigation for sections is much less. Whereas for litigation for vaginal delivery, if you have struggled to give a vaginal delivery, it's more. Who wants to risk it? Who wants to break their head and
roam around the courts or spend their time?
And spend so much of time and to face all these medical legal challenges? Who wants it? So if we are really, if people trust the doctor, then also section rates will come down. Okay, seriously.
Ma'am, as the IVF pregnancies are really increasing, might be
Yes.
planning the pregnancies late or whatever reasons, so IVF pregnancies rate is definitely increased. So do you think all IVF mothers should go for a cesarean?
Really not. Okay, if there are complications which are compromising.
So it is completely a normal pregnancy. I mean,
Absolutely. See, they have had problems conceiving,
that's it.
not carrying on with the pregnancy.
So that is not
Yeah.
an indication.
That's right. If a mother is able to get pregnant, yeah, and if she is able to have an uncomplicated pregnancy, why can't she deliver normally also?
Yes.
Okay. And the other thing, important thing, Ramya, in IVF pregnancies, the complications can be more because of the age, etc., etc. So many factors. And also, of late, the complications of pregnancy are also more. That's why the section rates can also be more. So it is just not the factors that I mentioned, but the complications also add on to the section rates. Okay. If you had monitoring facilities and if you can make the labor and delivery safe, you could still give vaginal deliveries. For how many high risks don't we give vaginal deliveries? Yes.
Last week itself, we had 2 IVF mothers who delivered vaginally.
Yes.
And so many
Every
high
day,
risk. Yes,
every
yes,
day
yes,
we have
we
high
are
risk
having the high
pregnancies
risk.
and
We are seeing
we
that.
do give. Okay. And also, unfortunately, we don't have midwives to support us in this country. Otherwise, yeah, the normal deliveries could have been looked after by midwives. Okay.
But in India, definitely they should come to the doctors, ma'am. Let them.
No, if midwifery care is developed, why not?
Yes.
You know, okay, why not? But I think we are sort of doing the midwives' roles also, doctors and midwives' roles. And I think we should be sincere to give the best of care to our women. That's what I feel. Coming back to this midwifery care, I think it should come up for normal deliveries. I mean, for low risk labors, it should come up. And also, we do have obstetric physiotherapists who keep the woman
Active during their labors.
During labor. That is also very, very important. So, obstetric physiotherapists, midwifery care, all these will improve the quality of care for women. And more number of them can have the experience of or the joy of giving birth to the baby. It is a joy. It is a privilege of every woman to get pregnant and deliver normally most of the time. It is not a disease. I keep telling them that it is not a disease to be seeing a doctor.
Yes.
Yeah.
Without a disease, they'll keep visiting us.
Yeah, so many times. So many times. It is only, yeah, this is the only condition where they see a doctor without a disease.
Yes.
So many times. Okay. So, it's, I think we have to respect the woman's body as something designed to get pregnant and deliver most of the time normally. And also, 18 months of breastfeeding has a lot of advantages for the mother, of course, and for the baby also.
Ma'am, people are really not familiar with the group practice. They know they will go to a single doctor, single obstetrician as soon as they're pregnant, and they'll be having their regular checkups with that. So, but we are doing a group practice. So, how do you feel that will help the people, or how are we doing that? The people should know what is group practice. How you will tell in simple.
Right. See, a lady can be seeing a particular consultant
Okay.
throughout her pregnancy. But they should accept that the person who is on call for the labor ward, that is the consultant who is on call for the labor ward, they should accept them to deliver their baby.
Okay.
Why have we brought in this? Because this consultant who is on for the labor ward does nothing else other than just
Managing the labors.
managing the labors. So, the labor ward and the women are kept very safe, and also there is a continuity of care there, and also they are quite fresh because they will not be doing outpatient, they will not be doing other gynae surgeries, they will not feel tired because they have been on for the labor ward, and
Before
they are,
night.
they are on for 24/7. And the next day they are off. So that, yeah, they
They're
are also
fresh and energetic.
yeah, we keep them fresh and efficient.
Yes, which is very important.
Very, very important. See, why did I start this group practice? Because when I looked at the Western practice, every 8 to 12 hours, the ICU, NICU, pediatric ICU, and also labor ward staff kept changing. So there was so much of efficiency, so much of freshness, so much of what can I say, alertness, precision, etc. If one is tired, you can't be doing that. And 24/7, 365 days, if you don't want to program labors, if you are a sincere practitioner, how are you going to manage? Obviously, safety can be compromised, and also cesarean section rates will go up, isn't it? So, we wanted to have this group practice, which we started in way back to 2007, and we have continued this. And I hope and pray that more number of obstetricians take this because, and also it brings in a work-life balance for them also.
Ma'am. They can balance their
Family. Yeah, children, etc. Yeah, if you want to give the best children to the world, why can't you have the best children? And why can't you give the best to your children? So that is.
So we should give a time there at home also. So
That's
to balance both our personal and professional lives without compromising anything.
Right.
So might be group practice.
In a group practice, they should accept that they are seeing a consultant throughout the antenatal period, but that consultant might not be there for her delivery.
Yes.
See, if you are seeing only one consultant, not that she won't fall sick, not that she won't take holidays.
And we are not sure whether she is going to be available on that day or not.
Absolutely. And also, we cannot be sort of sectioning them before we went for holidays or postponing that for after coming back from the holidays.
It is not right, definitely.
It's not right for women, isn't it? So, I think it serves as a very, very important thing to give quality care to women. That's the whole intention. Yeah. And of course, people of same vision and mission should be there in the team. Otherwise, 16 people in a kitchen can be a mess.
Thank you. Thank you, ma'am.